Hi, welcome to Dede Talks, the Art of Specialty Lenses. Today we're going to continue our conversation with tangible sciences.
Okay, so to demonstrate, I think one of the most impressive properties of Hydra-PEG, we made this demonstration that mimics the natural tear film. So in this beaker, there's a layer of saline. On top of it is oil that we've colored to make it easier to see. And you can see that this lens on the left is plasma treated only. So even though it's wettable, it does not repel the oil and allow the lens to sit nicely in the tear film. Whereas the lens on the right, when it's dipped in the oil, it is wrapped in this natural layer, so it's completely repelling all of that oil and preventing deposits from sticking to the lens. In order to make this a little more visual, I also had made a demo that Kim can show you. This is just what scientists do when they're having fun in lab, I guess. One of these spheres has the Hydra-PEG coating on it, and the other one does not. And as you can see, as they pass through the oil, which is sort of simulating what happens when a patient blinks, a lot of that oil is sticking to the uncoated surface, whereas Hydra-PEG is really preventing any of that oil from sticking to the surface of the sphere. Okay, so the question is, when we make this coating, it does all of these great things on the benchtop to the lens, but does it really make a difference for patients? So we've done a lot of clinical studies to test this and seen dramatic improvements in comfort, patient preference across lens types and patient types. This is some clinical data from a study that Chandra Mickles did on scleral lenses in dry eye patients, and just looking at sort of symptom surveys with comparing no lens to a scleral lens, which has some improvement in dry eye patients, but then with Hydra-PEG has really a dramatic improvement in the symptoms of these patients. She also looked at physiology and saw really dramatic improvements in staining and lid wiper epitheliopathy. With that one specifically, we actually saw a really big improvement just with coated lenses, which I think speaks to the importance of the lubricity of this surface and the eyelid gliding over it continuously all day. Kim, do you have anything else that you wanted to add for the patient perspective or results that we see with Hydra-PEG?
Yeah, when I speak with practitioners and patients, I find that patients are really having great outcomes with just having longer wearing time throughout the day, more comfortable wearing experience, and more reliable wearing experience, meaning they're not having to take it out and reinsert their lenses as much throughout the day or rely on drops as much. So just their overall experience is better. And when patients, we know that we make it easier for them to be compliant whenever they're comfortable. When they're not comfortable, they're not going to wear their lenses. No matter how good the practitioner thinks the fit looks or how good their vision is, if they're not comfortable, they're not going to wear their lenses.
Thanks, Karen and Kim, for those great tips on tangible. I'd like to thank ABB for their support of Dede Talks, the Art of Specialty Lenses.